Okay. So some other challenges that we face in this world now.
Come on, stock market's back up. Financial pressure's gone now.
Yeah, right.
Yeah.
Thanks,
I heard the
Donald.
China market's going crazy too. So you guys are you guys invested in that or what?
Yeah. Yeah, COVID's up the front, huh?
Yep. So COVID's pretty high. Climate change has dropped off a bit because
Yeah.
It's not as right now as everything else.
It's not as right
It's not
now.
immediate, Rob. That's right. It's less
not as right
immediate
now in
than
your
it
face,
was.
is it?
Yeah.
So isolation from colleagues, is that financial pressure? I mean, I think goes with hand in hand with the COVID situation.
Yeah, for sure.
All of the above. Okay. Any comments on that before we move on?
Yeah, no surprises there. I think climate change certainly dropped back because it's not immediate. COVID-19 is immediate, along with the financial pressure.
Yep. Okay, and one about, do you know your local support services, which I thought was worthwhile. Okay, so there's a limited knowledge of these, of even what's available, it seems. So, Clive, you're in that space more than any of us. What's your thoughts on that?
Yeah, I think it's many people are aware of. They hear about them, maybe TV ads and so forth. That doesn't mean they know the phone number or anything like that. I think most people are familiar with it. At least there are services out there, maybe not by name and so forth. But again, there are some great resources out there. And actually, when I knew I was coming on here, I just refreshed the local ones here in Australia. And I noticed there's men-specific ones, male-specific ones that I actually didn't know were, besides Are You OK and so forth. But there's suicide callback hotlines, and there's a bunch of new ones. It does serve us all well, not just for our own mental health and support, but reaching out to other people and being able to give them resources. It does pay to actually know what they are. They're out there. I can't speak for Canada or New Zealand, but I'm sure as similar democracies, they're out there.
Yeah, we have one specific number for the New Zealand Telehealth Service, which is 1737. And that number can be texted or it can be called from a mobile phone, and it gives you access to a professional trained counsellor immediately. So it's a great national resource. And then, of course, then there's a wide range of other resources as well, but that's a really good one. Very simple number to remember as well, 1737. I'm going to chuck that in the chat too.
Thank you.
Okay, great. I'm going to bring up that slide that you sent me through.
Okay, yeah.
And then people can see it on their device and screen. So there's some of the support networks in Australia, but it'd be worthwhile finding out for yourself and searching around what else is on, because sometimes these things can be a bit of the secret society, and getting them out there and letting people be aware of that they even exist, and try different ones, and some might work better than others for people, but we'll share that around anyway afterwards, and
that'd be good.
and get that out there. So I'm delighted with how the discussion's going. I note that Gwendolyn Galsworth has joined us some time ago from America. So I'm delighted to have her. Gwen is #1 in the world for visual management, visual thinking. Some might have heard of her before. So there's someone's put the crisis text line from Canada wide. Is that you from you, Rob?
That was me.
Yeah, fantastic. Greg's put in the New Zealand number. Okay, so
throw a few more in shortly as well.
Yeah, so let's get some thoughts from people in the attendees. Have you had dealings with some of these centres, or what have you found effective? Let's get some chat going.
I was going to actually ask the panel, because I've often Googled them and I've never had the courage to click send or to call them.
I will say I have used suicide helplines. particularly Lifeline. And in a moment of absolute crisis, this is an absolutely phenomenal resource. You're speaking with somebody who's non-judgmental, who's simply there to be an ear at a time when you absolutely need that ear. I'd say this when I'm speaking about this, and say there is no shame in calling a suicide helpline or a mental health helpline at all. And I've done it. I've done it on a number of occasions, and they are incredibly valuable.
Mm-hmm.
Well, I'll admit to being in Rob's category. I've searched them and looked up the websites, but I haven't actually contacted any.
I do know about Lifeline's training. I know the coaching that their volunteers, and they are volunteers, go through, and they're really solid. Lifeline is an absolutely brilliant organisation here in Australia, and yeah, they'd be my first port of call, I think.
So Clive, like maybe you can help me out a little bit just in terms of understanding, like oftentimes I've had conversations with EAP therapists, and they've always tried to go down this route of CBT where basically they're like, oh, you think about killing yourself, just think about something else. And for me, I've always found that ridiculous and ineffective in every way. Like literally maybe 2 months ago said to me, like, when you're going to bed and you think about killing yourself, just say like, oh, that's not for right now, that's for tomorrow or something. Like, and it to me, I don't know what to do with that. And so I just like, if I was going to call one of these lines, are they going to give me something like that, or they're going to like help me? How are they going to help me?
Well, number one, Rob, you've had a bad trot of professional help over there.
Maybe I'm just unlucky. I don't know.
No, please don't generalize. But let me go to EAP first, because you know, I've worked with EAP providers a little bit over here. In fact, that's how I got into mining, was through that work. Sadly, EAP providers, they're paid by the companies and so forth. Just like the government here, they will give somebody who's, say, got depression or anxiety, I think I forget the exact number now, don't quote me, it's about 8 sessions, limited to 8 sessions that you can actually get through the Medicare system. Yeah. And hey, you know, some challenges take a little bit more than 8 one-hour sessions. You know, EAP providers, they might have 60 minutes with a client, you know, to talk through depression. They will go then, and to a degree, it's not completely their issue, they will go to what we'd call sort of solution-focused therapies, CBT, fix the thinking. I hope nobody would ever say what they said to you there again. But it should never just be that. That's not enough. They should be instantly referring you elsewhere so that you can have ongoing help, ongoing assistance. The company needs to get in behind that too. What I learned when I learned this through working in the addictions, because at uni, we cover CBT, we cover all the various modalities. And I said earlier that students fight over which would be the best for this. Most astute, I think, psychologists use what we call an eclectic approach. That is, we don't just use CBT, we don't just use psychodynamic theory, we actually look at a client and what's going on, and we actually use what is most likely to do the best. And I think, things like CBT sometimes simply don't touch the sides, right? You really have to, first up, you need to listen aggressively. You really need to be absolutely outstanding listeners so that you can really, before you go into actually wand waving, my experience tells me if you listen long enough and you support hard enough and you build trust enough, usually the client themselves know exactly what they need. I'm not saying the client has to have all the solutions, but you're not going to get to that by just saying, you're thinking wrong. You need to change your thinking. That's not going to do any good at all. And again, it might just be, we need sort of good referral networks that people have used, both individual counsellors and collective organisations are helpful. We need actually to find out ones that are going to work for us. It's that relationship, Rob, that's going to do the good.